today's video we'll discuss about deep venous thrombosis. Now, as the name suggests, it is a acute thrombosis of deep veins, which, if not treated, may lead to pulmonary embolism. So, this is the main cause why deep venous thrombosis is very important, because it might lead to pulmonary embolism. You must remember this. Now, coming on to the precipitating factors. To remember the precipitating factors, now, why will a thrombosis occur in a deep vein? If the person is on prolonged bed rest, by bed rest, remember post operative immobilization, pressure on calf muscles, then sluggish blood flow. Now, coming on to the side. Inside, it can occur in the venous sinuses of the soleal muscles. Also, it can involve the pelvic veins. Now, coming on to the causes. To remember causes, just remember this acronym thrombosis. Now, coming to the T stands for trauma when there is an injury to the vessel wall. It stands for hormones leading to increased coagulability. Now, R stands for road traffic accidents. O stands for operations such as cholecystectomy or prolonged surgery. M stands for malignancy, blood disorders, orthopedic surgery, or obesity, or old age. S for serious illness, immobilization, splenectomy. Now, coming on to the pathophysiology. In pathophysiology, you just need to mention the all the events that were occurring in a normal thrombotic reaction. So, in a normal thrombotic reaction, what we see is there is a vessel trauma. Now, it stimulates the clotting cascade. Now, what happens? The platelets they aggregate, platelet aggregation. This leads to venous stasis. Now they form the initial clot. Then RBC gets entrapped into this fibrin clot. Then there is thrombus formation. So thrombus propagation will occur. This will lead to inflammation. This will invade the vein wall and it will destroy walls. Okay. So now coming on to the clinical features. For clinical features, first of all, it occurs on the second day. Also, it can occur on the fifth to sixth day of post-operative. Basically, the clinical presentation will be more visible on the second day or the fifth or sixth day of post-operative period. Now, the first complaint that the patient complains is of edema, erythema, and dilated veins. Okay, now first of all, there will be a dull or a nagging pain in calf muscles. Then there can be superficial blebs on skin. Then inflammation, okay, symptoms low grade inflammation. Low grade inflammation, basically low grade fever. Okay, increase in the pulse rate. Now here are two terms that I want you to remember. The first one being dolsa phlegmasia alba dolens. Okay, and the second one that I want you to remember is phlegmasia corellia dolens. Now alba is the white leg and corellia is the blue leg. Now, what do I mean by this? Now, this occurs when the thrombus it extends from the calf region to the region of iliofemoral veins. Okay, so Iliofemoral veins. This occurs basically due to the loss of the superficial tissue on the toes. Loss of superficial tissues on toes. This is basically phlegmasia. Okay, the correct spelling. Now coming on to the signs. In science, there are two signs which are very important. The first one is the Homan's test, and the second one is the Moses test. Moses test is usually not done because due to the fear of embolism. So what happens in the Homan's test? In Homan's test, what we do is there is a we ask the patient for forcible dorsiflexion of foot. So when he does this, there will be severe pain in the calf region. Obviously, in calf region, severe pain in calf region. In Moses test, we squeeze the muscle from side to side. Then what happens is we feel tenderness over the calf region. Now, in stages, by stages, you can remember it by an acronym named as PORER. Okay, so for PORER, first of all, you need to remember the propagation, organization, recanalization, embolism, and resolution. Now, embolism, it can lodge into the inferior vena cava and it can further lead to what we fear, which is pulmonary embolism. Now, for investigation, first of all, Doppler study. Now, Doppler study is mainly done for femoral vein thrombosis. For femoral vein thrombosis. Now, what happens is basically when there is the end of inspiration, okay, inspiration. So, there is a windstorm sound which disappears during the end of inspiration in a normal person, in a normal femoral vein. But in femoral vein thrombosis, what you'll see is there is no such sound. Okay, now the second investigation is contrast venography. As the name suggests, what we'll do is we'll take a radiopaque dye and we'll inject it, and then it will reach into the dorsal venous arch and it will stain the clot, so it will show us the filling defect. So this is not routinely done because it is invasive as well as it is expensive. Now coming on to the treatment. First of all, the conservative treatment is the first modality. Bed rest, then heparin injection of 10,000 units or IV bolus with continuous infusion of 30,000 to 4,500 units per day, 45,000 units per day. Now during this therapy, what you will see that the activated plasma partial thromboplastin time, it will become doubled. The international normalized ratio, it will come in range of 2 to 3. Also, after heparin, what we do is we give warfarin. Now warfarin is usually given after 2 to 3 days after heparin has been stopped. Now the dose of heparin is 10 milligram 2 times a day. Then we can do a lytic therapy. Where lytic therapy is not possible, we will do IVC filter. Now coming on to surgery. For surgery, remember two names. One is the Palma operation and the another one is the May Hersney operation. In Palma operation, what we see is this is basically done for iliofemoral thrombosis. Now, in this, what we do, we are basically going to take a common femoral vein and then we are going to anastomose it with the femoral vein on the opposite side. Similarly is May-Husney's. In this May-Husney's, what we do is we connect the popliteal vein to the long saphenous vein. Now in complications, there can be edema, there can be embolism, also there can be secondary verocity, varicosity, sorry, and there can be a non-healing ulcer. Now for prophylaxis, first of all, lifestyle modification, decrease the obesity because it was one of the precipitating and etiological factor. Then low dose of heparin. Now heparin is given basically 2 hours before the surgery, also 24 hours before surgery. Then intermittent pneumatic compression of calf muscles, compression of calf muscle during operation. Also, give we can give dextran 70. Now dextran 70 is a blood product which is synthetically derived. Now dextran 70 has the function that it basically Rolex formation. So basically it inhibits the sludging of RBCs. Now also you have to mobilize the patient. Also low molecular weight heparin can also be given. So this completes the deep venous thrombosis, which is important because it can lead to pulmonary embolism.